Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 38-year-old male construction worker presents with complaints of progressive numbness, tingling, and weakness in his dominant right hand. He reports that the symptoms worsens during his workday and at night, especially after gripping tools. On examination, he has noted weakness in a positive valence test. Which of the following is the most likely diagnosis? Is it A, radial nerve compression, B, carpal tunnel syndrome, C, medial epicondylitis, or D, lateral epicondylitis? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here, the stem of the question states, which of the following is the most likely diagnosis? You know what I always tell y'all? When they're asking you for a diagnosis, you need to run it back and look at those assessment findings. Look at the signs and symptoms. Look at how they present. Look at their chief complaint. Look at what is noted on exam, right? Picture this person in front of you, because we start assessing people as soon as they walk through the door. So the scenario, as they're telling you the history, the chief complaints, what is seen, what is noted on exam, is you doing all of those steps. Okay. So this is a 38-year-old male. He's a construction worker. Complaints of progressive numbness, tingling, and weakness in his dominant right hand. He reports the symptoms worsen during his workday and at night, especially found when he's gripping tools, right? And he has noted weakness, but also a positive valence test. Now, if nothing else told you anything, the valence test should confirm B, carpal tunnel syndrome, right? Because we do what test to confirm a diagnosis of carpal tunnel syndrome? We do our Tunnel sign and our valence test, right? So your best answer here is B, carpal tunnel syndrome. All right, question number two. Which of the following is the most common presenting symptom of carpal tunnel syndrome? Is it A, wrist pain that radiates up the forearm? B, numbness and tingling in the thumb, index, and middle fingers? C, a sensation of heat in the wrist and hand? Or D, weakness in the shoulder and upper arm? Take a moment, tell me what you got. All right, so in this case, the stem is the question is the stem. So which of the following is the most common presenting symptom of carpal tunnel syndrome? And this is B, that numbness and tingling of the thumb, index, and middle fingers, as the median nerve of that wrist is what is injured, okay? And then lastly, question number three, a 55-year-old woman with a history of type 2 diabetes presents to the clinic with complaints of hand numbness, tingling, and weakness that has been progressively worsening over the past few months. She reports that her symptoms are worse at night and when holding objects for prolonged periods. On physical exam, you perform a positive Tunnel sign and valence test. Which of the following would be the most appropriate initial management plan? Is it A, immediate referral for carpal tunnel release surgery? B, corticosteroid injections into the carpal tunnel? C, conservative management with a wrist splint and lifestyle modifications? Or D, start physical therapy and occupational therapy for hand rehabilitation? Take a moment and tell me what you got, y'all. All right, so here the stem of the question states, which of the following would be the most appropriate initial management plan? Key here, they're looking for treatment, right? And it says initial. So what is that first line thing you would do? Now, I always tell you, if they're asking you for a treatment, you need to look and see if they have provided you with a diagnosis. And in the event that they have not, you have to go back a step further and look at the assessment findings so that you can determine the diagnosis. So they haven't told us the diagnosis, but you should have a differential in your mind, right? This lady has progressive numbness, tingling, and weakness She has it after prolonged periods of times, utilizing or holding objects. The Tinel sign and Phelan's test are both positive. This is confirmation for carpal tunnel syndrome, right? So, what are we going to do first line therapy? And that would be C. You want to go with your conservative management because you're going to splint that wrist. We're going to put it in a splint, try to do lifestyle modifications, meaning, hey, stop doing these repetitive things as much, or pay attention to how much you're doing these things. But when you are, make sure, like if you're typing, do you have proper the hand? What am I trying to say? Oh my gosh, what's the wording? Like body mechanics. So making sure that you have your hand in the right form so that you're not injuring or hurting that wrist, and doing the things almost like the guy. Also, he does construction work, so a lot of gripping of tools. So wearing this splint during this time that you know that you're going to be utilizing that wrist and median nerve so much. So those type of lifestyle modifications, of course, after you have done these things, if it continues to progressively worsen or there's no improvement, then you would go to getting these things where you're referring out so they can potentially have surgery, etc. But you want to start with the conservative management with like wrist splinting, okay? All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. All of the things that I do offer are linked in the bio of this channel. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.